put your feet in case I have to get up and I trip over them.
Hello, Anne. My name's Julia. I'm a paramedic with Ambulance Tasmania. How are you?
Good morning. Fine, thank you, Julia.
I'm here today just to conduct a neurological assessment on you today, if that's okay.
Yes, of course.
It'll involve me getting you to obey a few commands, getting up and walking around, repeating some things back to me, all that kind of thing. I'm just going to grab my pen so I can get you to look at it. There we go. Okay, so first things first then, how are you feeling in yourself today?
Very well.
Excellent.
Yes.
Any concerns with any headaches, anything like that?
No.
No?
No.
Do you normally wear glasses?
For reading and
okay.
for a bit of distance.
And I can see
driving.
You've got hearing aids in, that's normal.
Yep.
Okay, great. Okay, so do you know what day it is today, Anne?
It's Wednesday.
Okay, and the month?
June.
And the year?
2024.
And can you tell me who the Prime Minister is?
Anthony Albanese.
Well done. Excellent. It's hard to... Sometimes
Elbow.
you just never know. And so to start with, Anne, I'm going to just list 3 objects, okay? And I'm going to ask you to recall them at the end of the examination. So we're going to say cat, avocado, and football. Great. Okay, so the first thing I'm going to do is just work my way through your cranial nerves. Okay, so any trouble with your sense of smell lately? You smelling?
No.
No? Okay,
No.
great. You smell coffee and things like that?
Oh, yes.
Okay, great. So what I'm going to do now, and I'm just going to shine a light into your eyes. Okay, well, I'm looking for both direct, just keep looking straight at me, that's the way, direct and consensual pupil response. Wonderful. Okay, great. Any trouble with your vision?
No.
No? Okay.
No.
So the next thing I'm going to do, I'm just going to move this pen in an H shape. I'm just going to get you to follow it. All right? Lovely. So I'm just looking for all the ocular movement. Lovely, lovely. And across. And this way. So I'm not noticing any irregular movement. I'm also looking for ptosis. Have you had any double vision, blurred vision, anything like that?
No.
Okay, and you're going to get to go a bit cross-eyed here. I'm just going to get you to follow the pen to your nose. Wonderful. So that's just testing all the ocular muscles. Next thing I'm going to do is just check your visual field acuity. So can you see my fingers right now? When you're looking at me, can you see my fingers?
Yes.
Okay, I want you to tell me if you lose sight of them at any time. You still see them in your periphery?
Yeah.
Lovely. And you can see, you're not losing them at all?
No.
Wonderful. Okay. Excellent. So that's great
Good.
great visual acuity. Okay, so we're just going to move on to some muscles in your face now. So I'm just going to check sensation first. Can you feel that?
Yes.
Same as that?
Yes.
Can you feel that?
Yes.
Same as that? Lovely. And there?
Yes.
And same as that?
Yes.
Okay. Can I get you to bite down? Great. And again, bite down. Lovely. Okay. I want you to shrug against me. Shrug your shoulders. Okay. Lovely. Perfect. I'm going to get you to look to your left. I'm going to resist a little bit. Excellent. And look to your right. Lovely. Stick out your tongue for me. Give me a cough. Lovely. I'm going to get you to put your tongue into your cheek and resist. I'm going to try and push it. Lovely. And other side. Excellent. All right. Give me a big smile. Raise your eyebrows. Give me a frown. Show me your teeth. Oh, lovely. Excellent. All righty. So we're just going to move on to the nerves that do your hearing. I'm going a bit out of sequence here, but I find this is more streamlined assessment. So I'm going to cover this here with this hand. Can you hear that?
Yes.
Lovely.
Yes.
Can you hear that?
Yes.
Wonderful. Okay, so I'm going to get you to say a few things for me. British Constitution.
British Constitution.
My margarita needs more tequila.
My margarita needs more tequila.
Wonderful. Excellent. So next of all, I'm just going to check, look for any sort of cerebellar symptoms. So that's sort of the back of your brain. So what I'd like you to do for me, I'm going to stand up. And I just get you to turn around, take 4 steps and turn around and walk back to me. Lovely. Gait is normal. There's no loss of balance on the turn. Wonderful. While we're standing up, we're just going to check our tone to our hips. So we're going to get you to bring your knee up like that. Hold it for a second. Lovely. Good balance. And other side. Your arms look the same. Lovely. Perfect. Okay, so if it says gait, that looks normal. Can I get you to, I'm going to get you to shut your eyes. And now I want you to stand still for 5 seconds try not to waver. So 1, 2, 3, 4, 5. Lovely Romberg negative. Have a seat, Ed.
Thank you.
So we're going to do a couple more things for me. Can you give me your boxer's arms? Don't let me pull them away. Lovely. And what I need you to do next is take your heel and just rake it down your shin for me like that. Lovely. And other side. Perfect. Okay, so can I have one hand out like this and other hand like this? And what I'd like you to do is we're going to alternate. So clap, yep, and nice and quick. Fantastic. Okay, so the next thing, I'm going to get you to take your finger and touch your nose. And now touch my finger. Touch your nose, touch my finger, touch your nose, and touch my finger. Lovely. So there's no sign of past pointing. She's not having any issues with that at all. So now that cerebral nerves done, and so cranial nerves done, and cerebellar assessment I'm happy with. There's no ataxic gait, no intention tremor, no past pointing. So what we're going to do next is work through your upper and lower limbs. Okay, now I've already checked her hip flexion, so I'm not going to make her do that again. So I'm going to get up at this point in time, and we're just going to do a few things. Can I get you to, you can stand up for me actually. Arms up and down, looking for any uneven movements, and robot arms. And we're going to go out and in. Lovely. Can you do it against me? Excellent. So the strength is equal and good. So hands up like this. Push. Don't let me bend your hands back. Lovely. All right. Can I get you to touch your thumb to each finger? Bit of arthritis there, but neurologically you're fine. Okay. Have a seat for me, Anne. Can I get you to extend your leg out against my resistance? Lovely. While we're here, push down like you're driving a car and up against. Wonderful. And down again. And we'll do the other side. Pardon my butt. Up. Yep. Sorry, down for me. Down. Up against resistance. Excellent. Push down like you're driving a car and up against. Fabulous. So we've got good tone, power, coordination, proprioception. Can I get you to shut your eyes for me and hold out your hands? What am I touching?
Forefinger.
On which hand?
My right hand.
And now what am I touching now?
Little finger on my left.
And now which am I touching?
None of them.
None of them. Wonderful. Okay. So I'm happy with Anne's proprioception, coordination. I'm not going to test reflexes because I don't have a reflex hammer and I don't like hitting my mother. So to finish up, Anne, everything's looking great today. There's no signs of sort of any sort of hemiparesis, weakness, anything like that. Your gait is good. I'm not seeing any issues with any of your upstairs functions, and your downstairs functions seem great as well. Yeah. So what were those 3 objects I got you to remember at the start of the exam?
A cat, avocado, football.
Well done. All right, 5 stars. Thank you very much.